Welcome, and thank you for tuning in to the Nassau County Emergency Management Back to School During a Pandemic Roundtable. I'm Greg Foster. I'm Director of Emergency Management for Nassau County. Nassau County has 12,000 plus students who attend 16 district schools, and it is expected that 80% of these children are intending to be in the classroom on Monday, with about 20% being in virtual school. I don't have to remind everybody that we've all spent the last several months trying to comply with the CDC and FDOH guidelines when it comes to preventing the spread of the COVID virus. Today we are lucky to have a panel of public health and education experts to answer any questions that many of you have in reference to how we're going to keep teachers and students safe and healthy during this school year. We are lucky enough to have this instance where we are in the third session of these roundtable events. The first one was mental health and COVID-19. Then we had hurricane and COVID-19, and now we're lucky enough to do what the school year is going to look like with the COVID-19 virus. We are going to try to get to as many questions as we can during this session. It's quite possible that we don't get to everybody's question during this process. We will have information at the end of this session on how we're going to answer those questions and how you're going to be able to get answers to your questions that are presented. So with that being said, I want to introduce our panel. First, we have Jessica Watkins. Ms. Watkins is a graduate from DA, or Douglas Anderson High School in Jacksonville. She obtained her degree from the University of North Florida. Ms. Watkins has been a fourth grade teacher in Nassau County for 10 years and is currently assigned to the Yulee Elementary School. And kind of a note on that, Ms. Watkins was the Nassau County Teacher of the Year in 2019. Thank you for being with us.
Thank you.
Next, we have Teresa Rowe. Ms. Rowe is the Senior Community Health Nursing Supervisor and School Health Coordinator with the Florida Department of Health in Nassau County. She has worked with the Department of Health for 23 years and resides with her husband Keith on the west side of Nassau County. School health, student safety is kind of a special thing for Ms. Rowe, being that she's had 2 daughters and a son go through the school process. And now she has 4 beautiful grandchildren, and one of those is starting in kindergarten this year. So congratulations on that.
Thank you.
And thank you for being with us today. Next, we have Mark Durham. Mark Durham is currently the Assistant Superintendent of Instruction for the Nassau County School District. This will be Mr. Durham's 5th year in Nassau County with the school system. After serving 31 years in Georgia as a teacher, coach, assistant principal, and a district administrator in Georgia. Thank you for being here, Mr. Durham.
Thank you.
And next we have Juliana White. Juliana is a student in one of our wonderful Nassau County schools. Juliana this year is going to be a senior at Fernandina Beach High School. That's exciting. Congratulations, and thank you for being here with us.
Thank you for having me.
Yes, ma'am. So the Center of Disease Control and Prevention has given some guidance, kind of just to give an overview. When it comes to COVID-19 and trying to restrict the spread of COVID-19. Those include stay at home whenever you're sick, wash your hands often, cover your coughs and your sneezes, preferably in your elbow or your shoulder, not in your hands. Or wash your hands repeatedly if you do cough into your hands. Keep 6 feet of distance between people, and if you can't have that social distancing, to wear a mask or a face covering. We'll kind of get into that a little bit later. And also clean and disinfect all frequently touched surfaces. And that's one of the things that's kind of difficult to remember because we touch so many things in a day, cell phones, computers, countertops. So we'll kind of get into that a little bit later. But we kind of, the way we're going to do this is kind of walk through the student's day, kind of give an idea of what the student's day is going to look like and what precautions have been taken to make sure they're as safe and healthy as possible in the school setting. So to kind of begin that process, Ms. Rowe, can you give an idea of when they wake up in the morning, and I know it's hard to get a child up in the morning sometimes, but when they wake their child up in the morning, they wake their student up in the morning, what is that going to look like? When should they and when they should they not send their child to school?
Well, we have a daily home screening tool
for parents to be able to utilize. And we ask that if their child exhibits any of the following symptoms on that screening tool, that this could indicate possible illness. It would decrease the student's ability to be able to learn at school, as well as put other students at risk. So if they have any of the following symptoms, such as a fever of greater than 100.4, if they should have a new or an uncontrolled cough that would cause difficulty breathing, diarrhea, vomiting, abdominal pain, sore throat, or a new onset of a severe headache, especially with fever, we would please ask the parents, do not send your child to school.
All right. I'm sorry, Ms. Watkins. School years are a stressful time at the beginning of the school year. I've got a lot of family that are teachers in the school system or have been teachers in the school system. With the normal obstacles that you have in the school year, can you kind of talk about what you foresee being additional obstacles this year because of COVID-19?
Well, this year we've already started by separating our students as much as possible. They're going to be wearing a face mask, and when there's not able to be social distancing, we have a lot of one-way directional aisles and things like that. And then you always go over rituals and routines in the beginning of the year, and so just adding some of those safety precautions such as hand washing in the beginning of the year, making sure we're sanitizing, limited sharing of supplies, things like that we've put into place.
Sure, and everybody should be a little bit used to that, being
Yes.
the grocery stores. Everybody's used to those aisles that you have to walk up and down in the mask. Thank you very much. Mr. Durham, when it comes to policy and procedure in the school system, obviously this is something that you have been planning for quite a while in the school system. This has been going on since the beginning of March, or even before that this started coming out. So can you talk a little bit about the overall policies and procedures, what you've planned?
Yes, sir. We've been working for the last few months to develop what we ended up coming up with, which is our reopening plan, which I would invite any of our viewers to go to the website and pull this up. This has all the details in it. There's several other resources there as well that they can look at. There's a frequently asked questions page. There's a shorter version of this. It just has the most important details. And then there's also a series of videos of things that have been going on over the summer to get us prepared for the school year. There has a lot has happened over the last couple months, and as things change, we've had to even alter our plans within just the last few weeks when you get new information about what the research is telling us about COVID. But some of the major we will cover when you go through the different parts of the day, the different areas that are where we're going to have the precautions in place. But just to say, in general, our transportation department has made a lot of changes. Our food services department, our school custodial and facility staff has made a lot of adjustments in their program. We have stockpiled a lot of supplies, masks, cleaning, disinfectant for the custodians to use around the school and for them to be in place in the classroom to be used. Hand sanitizers are going to be available in just about every place that you go in the school, every classroom, cafeteria, media center, anywhere folks are going. Even dispensers are being placed in the hallways for students to use between classes. Water fountains have been turned off or have been covered, and we've been installing water bottle filling stations so that the students don't have to share water fountains or touch the same knob when they're getting water. We've put a lot of signage in the schools as far as safety precautions, just emphasizing the hand washing, the wearing of the mask. In most places, we've been able to have hallway directional arrows put in so that you have one-way traffic, kind of like you do in the stores.
Right.
These are some of the major things that we've put in place. With our messaging, we've learned with working through the health department and some of the training they've provided for our district administrators that the stuff that we really need to be focusing on are the mask wearing, top priority, the hand washing and the other types of hand hygiene, the distancing between people whenever you can, and then the contact tracing, and so that we can isolate and quarantine folks when it comes to our knowledge that they've been tested positive, so that we can identify groups that would need to go home and learn from home for a period of time. These are some of the major plans and not policies, but procedures we put in place. Again, that's all shared in very great detail in this document, and I would hope folks will go in and take a look at it.
Sure, and for the community, we'll post the site for that so that they can go in there and read that. Thank you for that, Mr. Durham. Juliana.
Yes.
So this is your senior year in high school. That's a very important time, and again, congratulations for getting to that point. What are you, as a senior coming into high school, what are some of your concerns? What have you done? What have your friends done to kind of prepare for the differences in this school year?
Well, we realize it's going to be different, though we're excited to go back. We know about the face masks, and I know students have already bought new masks or have chosen different colors or designs to make it more exciting for us in these times. But we're ready to go back, and we're excited to be able to.
I imagine so. It's 6 months they've been out of school, just about 6 months, somewhere in that general range. That's a long time to be out of school. So, Ms. Watkins, so again, walking through the school day, the students have been screened by their parents to make sure that they have none of the conditions that would indicate that they may have been exposed to COVID-19. Can you kind of give me an idea when the child shows up at school? Because a lot of the times when they first wake up, they won't show signs or symptoms of any illness, and then they get to school and they start showing those symptoms. Can you kind of walk me through what will happen if one of your students shows up and starts showing those signs and symptoms of COVID-19?
Sure. So if a student begins to show signs or symptoms, the first thing that I'm going to do is call the nurse, our school nurse, and kind of explain to her the symptoms that I'm seeing so that she knows what's coming. And that student would then go to the nurse's office, and we have a secondary nurse's office strictly for COVID-like symptoms, so it's separate than the regular nurse's office, and they would go in there, and she has all of her protective gear that she's going to put on and go in and monitor that student and decide then what would happen with that student. Back in the classroom, I would then, of course, sanitize anything, that area, all of those things to make sure that we're keeping everybody as safe as possible.
Okay. And I kind of skipped a little spot at that, and I apologize for that, Mr. Durham. But you had spoke earlier about transportation. Okay, the child has been cleared by their parents to go to school because they've done what they're supposed to do. Can you kind of give us an idea of what the school bus, the transportation issue is going to be like for the kids that do ride those buses?
Right, so social distancing will be a challenge, obviously, on school buses, but they are going to be required to wear their mask the whole time they're on the bus. They'll have hand sanitizer whenever they get on the bus, first get on the bus. We will be trying to load the buses as best as possible from back to front so there's not as much passing back and forth amongst the students. We're going to, if there are siblings that ride the same bus, they will be seated together or near one another to decrease the number of students that they come across in case one of them did come up positive. The bus driver will also have their protective mask and shield on as well. And we'll be assigning seats this year. That's, in the past, assigned seats were always the best way to go, but it wasn't really enforced. This year there'll be seating charts on the buses, and those students will be sitting in the assigned seats. So if we have to go back and contact trace a situation where there was a student that rode a bus and he was positive, that would help us not to have to quarantine everybody on the bus. After the contact tracing is done and it's determined that everybody were wearing their mask, that we were strict about sitting where we were supposed to sit, then our liaison at the health department would say, these are the students that we would like to quarantine, and these are the ones that don't need a quarantine because the close contact didn't happen on the bus. So we've put those things in place to keep our students safe on their ride to school.
Outstanding, thank you. And that's come up a couple of times now. The word that we've been trying to get out through emergency management over the months, contact tracing.
Yes.
So the child has come to you because they have showed signs and symptoms, and either they subsequently test positive or just based on exposure or perceived exposure. Can you kind of walk through that contact tracing protocol, how that works and what exactly it is?
Yes, so when a person tests positive, then a public health case investigator will work with that individual and create a list of people that they have been in contact with during a specific time frame. And then that contact tracer will then contact those individuals and provide them with the information that they're going to need in order to stay safe, such as quarantining at home. And then they may also create a list again from that individual, and we'll follow up with those to provide the information again that they need to quarantine and to stay safe. Within the school district, we have our epidemiology department has provided contact trace training for district administrative staff, who will then assist our contact tracers and epidemiologists with securing that list of contacts for them to investigate.
Okay, outstanding. Now, kind of to add on to that, there's been some confusion. We've gotten a lot of questions asked of us in reference to kind of the difference between quarantine and isolation and the different time periods that come along with quarantine and isolation. And there's been some changes on the CDC guidelines, Center for Disease Control guidelines. Can you kind of give an idea of what the current is in reference to isolation versus quarantine?
So quarantine is if someone is a contact to a positive case, and they would be quarantined for 14 days. So even regardless of if they go out and get a test or not, which we don't, unless they develop symptoms, then they would go into isolation. But they are going to be quarantined for 14 days. Isolation is actually, if someone tests positive, then based upon their symptoms, the minimum is going to be 10 days. But depending upon when they're in contact with the epidemiologist, depending upon their symptoms and the resolving of their symptoms and them being fever-free for 24 hours without fever-reducing medications, will determine when they are released from isolation.
Okay. Okay. We've got a question from some of the viewers, and this question's actually come up quite a bit, and I know you addressed it a little bit when I was asking you policy changes that are going into effect. But Mr. Durham, the question is, will masks be mandatory at all times? Can you kind of walk through the times of the day where masks are not going to be required?
Yes, we do. We are requiring masks on the bus, in the school, the classrooms, going to lunch, in the hallways. They are required when we can't properly social distance. So there will be times, so I'm not going to say the student's going to have to wear the mask from the time they get on that bus until the time they get off of it in the afternoon. There'll be times when they can take it off if they're outside and they're able to social distance from others. They'll be able to take it off then. Obviously at lunch, when there's a need for them to eat, they can't wear a mask while they're eating. We do have a little bit of difference in our K-5 plan as far as masks go and our 6 through 12. We do think the ability of the secondary students to keep it on for longer periods of time, we believe they'll be able to handle that a little better. So we're giving some flexibility in K-5 for teachers at their discretion when students aren't in small groups and they're working at their desk and they're at some distance apart and they're just doing independent work where they're not talking to one another or doing activities where they're interacting. So during independent work, when students are at their desk and they're apart from one another, then they can have an opportunity then to take their mask off. In the secondary schools, when they're having to sit through in our block schedule, our block high schools, which are 3, the students are actually in each class for 85 minutes usually. So we know that might be a long stretch, so the teacher at their discretion, they could have the students maybe go out a couple at a time outside and remove their mask so they can kind of regroup and get to catch their breath. So we are leaving some discretion on that for teachers, and we know that they'll use their professional judgment, and if it's not, and if administrators or someone else sees that they're not doing it properly and then maybe there's too much and we're not being disciplined enough in our mask wearing, then we certainly could address that. But yes, the masks are required, and we believe it's going to be a huge part of us being able to keep our schools open, because there's, in all the research and recommendations you can see from any health organization, the masks are necessary to protect everyone.
Thank you, sir. So, Juliana, you kind of alluded to it earlier when we first started talking about kids are going out and buying, students are going out and buying unique masks, and I've seen them around. Everybody's seen them around. There's all kinds of styles of masks now. Have you and the other students that you speak of, and you in particular, obviously there's going to be some differences this school year. There's when you're socially interacting with each other, you've got to keep a distance between each other, or you've got to wear a mask. I know that students typically will shake hands, they'll give a high five to each other, they'll fist bump, they'll hug each other depending on what the situation is at the beginning of the day or when they see each other in lunchtime. Have you guys, or you in particular, have you been talking to your friends about how you're going to address that? Is there any discussion about how you can say hi to each other without coming in physical contact?
I don't think we have discussed it. I think it's, we're all aware of the situation with COVID-19 and that we need to social distance as much as possible. So I think it kind of goes without saying not to come in contact with each other as much as possible. But I'm sure depending on the students' relationship with each other, I'm sure others are making plans.
And that was going to be one of my questions to you is, do you feel like your friends, like your fellow students, have educated themselves in reference to COVID-19, the dangers, what they should do? Do you think that everybody's educated themselves well?
I do. I think that most have a very good grasp on the situation and how we should protect ourselves and those we love. So yeah, I think we're going to do everything we can as students to stay in the classroom as long as possible, if depending on how the situation goes. So yes, I do think we're keeping up with the different guidelines and procedures that will be in place.
Sure, and it's an unprecedented time that we're going through. I mean, none of us have been through this. The last time there was a pandemic of this size, it was 1918. You know, and so it's something that is on people's minds. That is definitely something different. So, Ms. Rowe, in reference to masks and face shields, there's been a lot of discussion about that on social media. Obviously, masks and whether they're needed and whether that's something that should be required or not. But could you speak a little bit in reference to the difference between a face shield or eye protection and a mask or a respirator, and what they're both used for and what they protect or attempt to protect you from?
So a face shield or eye protection is just that. It's to protect your eyes. And so the mask protects us, the cloth mask are for source control. So my mask, of course, my cloth mask is worn to protect you, and your cloth mask is worn to protect me. The medical grade mask that we use and will be using in our clinics will also provide some additional layer of protection for the wearer as well, and from any kind of droplets. The respirator, such as the N95, we will be providing those for some of our clinics where, particularly our nurse that would be likely to perform procedures where there are respiratory droplets that could be aerosolized. So in those particular situations, we want them to be protected, and we are providing them with N95, the respirator mask, in those situations. So the face shield, though, again, to reinforce, the face shield is not a face mask. It, again, is to protect the eyes. So we want to make sure, at a minimum, we are wearing a mask, and then a face shield or goggles is also extra protection.
Okay. Okay, we've got another question from the viewers. Mr. Durham, there's been some statements and some information put out over social media in reference to when would school be canceled. And I know that that's not something that that any of us are hoping for, but can you kind of walk through the process of how potential surges will be addressed and how decisions will be made in reference to what to do about school?
Sure, we don't have a particular number or a matrix that we're going to rely on for that. We're going to take each individual school case individually. So we feel like through the contact tracing, there'll be times whenever we're just able to send home a small cohort of students, or there'll be times when we may feel like it's necessary based on the recommendation from the health department that a whole classroom might have to be quarantined for 14 days and do their lessons virtually for that long. Going beyond sending home a whole class, that discussion would take place between the superintendent and the local Department of Health, the EOC, and also the Florida Department of Education. If it came to a point where there were so many cases, that conversation would be happening along and along. You know, where are we? How many more cases do you think we would need to have before we close the whole school? So there'll be a lot of coordination going on with those different departments in making a decision if we were going to close a whole school down.
Okay. And we actually got another question from one of our viewers that is based on the same question. You know, how is it addressed? How are decisions made? So I appreciate that. Thank you for that. We got a question from another viewer. How will you handle students who are tested positive but are asymptomatic? Ms. Rowe, can you kind of walk through that process? Obviously, names aren't released on anybody who's advised that they're positive, but can you talk about how they're kind of tracked when somebody does come up as positive, how we know who is coming up positive?
So we receive those reports through the Department of Health. We are notified, and we do have a liaison within our epidemiology department who is assigned to the schools, who will be in daily communication with Mr. Durham, and names will be provided, lists will be provided of students who are not able to return to school, and then a list will be provided when those students are cleared and released to return to school. And that will be communication that will take place between our department and with Mr. Durham on a daily basis.
So there is no difference if once they come up as positive, once they've taken the test and come up as positive, there's no difference between how a symptomatic and an asymptomatic person is tracked and handled.
That is correct. They would still, yes, they would still be on isolation until they are released by the Department of Health.
Okay. Okay. Thank you, Ms. Watkins. Yes. So the school day started. The classroom has got the kids in it that are able to come to school. This is one of those questions that we hear an awful lot about. How are we going to make sure the kids keep their masks on? Can you give us kind of an idea of what you're looking at to try to make sure that the kids keep the mask on, the students keep the mask on?
Sure. I think, first of all, respecting others is a big thing to talk about with your students, no matter their age. And it's a big respect factor to wear your mask and wear it properly, because then you're keeping everyone safe. I also think another big thing is incentivizing the students. Incentivizing them to wear the mask and wear it properly will help. And also, as an educator, as a teacher, when you're wearing your mask properly, they're going to also, most of them fall in line with that. So respecting others, you being an example and wearing your mask properly, and then incentivizing those students to want to continue to wear their mask as well.
And this is actually something I should have brought up at the beginning, but just to let people know, we are wearing masks when we're not able to socially distance because of the nature of the program. It's kind of hard to understand sometimes over the mic if you're wearing a mask. We are socially distancing here, but we do have masks on hand for that. And Ms. Watkins, I saw that you have a special mask yourself.
I do.
That's neat. Okay, Juliana, I know that peer pressure is a big thing in school. I know that, and I remember that from a long time ago when I was a senior in high school. Do you think kids are going to be willing to come forward to the teachers and advise if one of their friends seems to be sick? Do you think they feel comfortable, or would you feel comfortable in approaching somebody from the school and advising, hey, this student looks like he's not feeling too good?
Personally, I definitely would, seeing as it's everyone's safety along with the students that's at risk. Okay. And they need to be in quarantine or get whatever help they need from a health standpoint. And also, I think as we talked about it's a respect factor, and I think most students realize that we need to wear the masks and be forthcoming if we do feel symptoms to protect those we love and our friends and our teachers so that we can all move past this as quickly as possible.
That's an excellent point. Obviously, there's always the concern about the child's health and the child's safety. But the information has come out. People have talked about it on social media, and the media has talked about it. The fact that the student, if they contract COVID-19, if they're exposed to COVID-19 at the school, that they can bring it home and bring it to their family and people that may be a little bit more at risk because of age or pre-existing conditions. So it's important to make sure that people don't contract it and don't get exposed to it. So now we're approaching the end of the day. The class has gone well, and it's time for the kids to go home. Ms. Rowe, can you kind of talk about what the parents should do when the student gets home? You know, should they screen them again? Should they talk to them about if they were exposed to somebody who were showing signs or symptoms? Is there a protocol in place for the kids to make sure that they wash their hands and do all that?
I think when they come home from school, most definitely the parents can encourage their child to wash their hands. And again, we talk to our school health nurses, talk to our students about the importance of keeping their hands away from what we refer to as the T-zone, the eyes, the nose, and the mouth, and making sure that they're doing proper hand washing. And so we encourage that in school. I think the parents should also encourage that when their child gets home. If the child is exposed to a positive case, the parent will be notified. We do have a general notification letter that will go out to the classroom, but in that general notification letter, it does state that if their child is a contact to a positive case, they will be notified and contacted by the Department of Health and then provided further instructions on what they need to do with their child.
Outstanding. Mr. Durham, if the child has been exposed and they're going to have to go through quarantine, or even if they come up positive, or for some reason the parents have taken them and got tested, whether they're showing signs or they're not showing signs, how are they going to keep up with the rest of the class? How, during that 10 days, 14 days that they might have to be out, and that's 10 or 14 of continuous days, so it might be 5 or 7 or 9 actual school days, but how are they going to keep
So
up?
they'll stay connected with their regular classroom teachers through our Canvas program, which we just purchased this year and just implemented, just trained teachers on before school. During the first part of our pre-planning sessions, they went through the training. So that's going to be available to us so that if a student, they can use their home computer, or if they don't have a computer, we can provide a device for them so that they can have access. Canvas will puts everything in one framework, one platform where they can get to all the same media programs that we have, any practice programs that we have. They'll be able to connect to their teacher through Microsoft Teams or Google Classroom, depending on which one the teacher chooses to use. That'll allow them to chat with their teacher, have a group meeting with other students that might be quarantined home at the same time with the teacher. So they'll be able to stay on pace with their classmates. They won't just be sent some work home to do on their own. They'll be keeping up with what's going on in the actual classroom through this distance learning program that we have now.
Thank you. We've got another question from one of our viewers. How many tests will be available to schools, and how soon are the results returned? I know we've been pushing out information for the last week or so in reference to targeted testing for school-age kids, being that school's fixing to start. Can you kind of talk about how testing is going to continue in reference to that?
We do have several sites, and that we will be providing testing for. We've had sites that have the emphasis on pediatric testing. We do have sites that will continue this next week as well. We have our schedule up through the month of September, And you could go to our Department of Health website, and I know as well as the emergency management site has those listed. And so we do continue to provide testing in our community, as well as I will mention that we are providing some back-to-school immunizations as well. We did have a back-to-school immunization drive-through this past week in Hilliard, and we will be having another Tdap drive-through immunization clinic Saturday at our Yulee Health Department from 9 to 11 as well.
Thank you. And we push out that information through our emergency management website. So the information will be provided over our website and through Everbridge and social media on where those testing sites will be taking place. For a child to return to school, this is another one for you, Ms. Rowe. This is from one of our viewers. For the child to return to school, is it based on time without symptoms or a negative test? I know there's been some confusion on the necessity for a negative test to be cleared to go back to work or school. Can you speak of that real quick?
So if a child presents with symptoms to school, at school or home, and the parent, there's two scenarios. If the parent chooses to take the child to their physician, and then they determine that the child it's not COVID, can the child return to school as long as they are fever-free? Of course. If the child does have a positive COVID test, then he's going to be excluded until he is, for 10 days at least, based upon the resolving of his symptoms and being fever-free. They do not have to have a negative test to return. We know that students or individuals may continue to test positive for up to 3 months after they have COVID. So they do not have to have a negative test to return to school.
Okay. Thank you. Ms. Watkins, can you kind of walk us through the training and the preparation that you've gone through for the school year when we're dealing with the pandemic?
Sure. So as Mr. Durham said earlier, we did do a Canvas training, which is the new virtual platform. So we had that. And then for specific COVID-related things, our back to school, our principals went through all of the different new procedures and routines that we were going to use as a school-based, based on the district plan. We also got face masks and shields for teachers as well. Part of that, we got hand sanitizer and spray to wipe down tables that are going to be used and things like that.
Okay, and on that note, Mr. Durham, I know from emergency management we've received a lot of PPE and passed that on to not only the school district, but a lot of the governmental partners and private business to pass out. Can you advise if the child shows up to school without a face mask, are there going to be face masks that are going to be available?
Sure, there'll be plenty of face masks at all the schools. So if a child forgets his mask one day, or if the family's not able to provide their own mask for the child, then we will have plenty of supplies on hand for anyone that needs one.
And that's at every school?
Yes, sir.
Okay, thank you. We have another question from one of our viewers, and this has actually come up quite often in the last couple of weeks. COVID-19 has been a progression of how it looks and who's it's affecting and the numbers, obviously. But if a family goes out of town, out of state, or out of country, is there a set plan to have them isolate based on where they go for 14 days, or is that a case-to-case basis?
To my knowledge, the directive concerning the out-of-state travel is no longer in place.
Right.
There may be some restrictions still on traveling to a foreign country. I'll defer to the health department on that. But as far as traveling within the states, I know that directive expired and it's not in place anymore. So that would not keep a student from being able to come to school.
Okay, yeah, and the county ordinance in reference to, or county executive order in reference to the tri-state areas has expired. Ms. Rowe, do you know is there still direction from the CDC on that?
No, yeah.
Okay.
Yes, that
Okay.
what Mr. Durham said is correct.
Okay, so it's going to be a matter of monitoring the child and seeing if they
Yes.
start showing signs or symptoms, or they come up with a positive test. Okay. Again, as this progresses through and as things inevitably change during the school year. I'm taking it that there will be that coordination between the Department of Health and the school district if guidelines change, if things change in reference to guidance on COVID-19. Is there a platform from the school district to provide the parents of the students with that information?
Sure, we have a lot of ways to communicate with parents, either at just the school level or at the district level. All the schools have their own websites. They all have their own Facebook page where they push out messaging. They all have communication systems where they can call every parent in the school with the robo-type call, or a call even with their principal's own voice on it. At the district level, we're keeping our COVID information link is right there on the front page. Whenever you go to the website, it'll take you to all of our resources, which includes the complete reopening plan. It includes the videos that have been done concerning safety and all over the summer, and several other resources that they can go to see what any new information that comes out. So we'll be able to push anything that changes out pretty quickly, and we know that communication can always be improved on. And we've certainly made some mistakes and not done as great a job as we would have liked to, because we always want to do better. But certainly communication is very important to us, and getting information to parents and to the community is going to be top priority for us moving forward.
Okay. Thank you. Juliana, can you advise us on where you're getting your education from? What kind of websites do you go to find out information about COVID-19 and what precautions should be taken?
Well, regarding school, our school has a website, as I'm sure most, if not all, do. So we go to our school's website to learn how to prepare for school in regarding to COVID-19. And as regarding COVID-19 as a whole, we do go to sources like the CDC to get our information, along with local news to see what's going on in our areas as well.
The internet provides you with a lot of information.
Yes, sir.
Didn't have that when I was in high school. Got a question from one of our viewers. If the mask ordinance for the county expires, will the school still require them? Is there a plan in place for that?
Yes, sir. We would still continue with our mask plan until at some point, with coordination with the health department and others in Emergency Operations Center. I think that would have to be a conversation of the whole group before we made a decision not to require the mask at school, because we know that circumstances are different within the school on a school day than they are, for example, going to the grocery store, going out to a restaurant. There's a lot more interaction amongst students and adults at the school. So that expiring would not necessarily mean that we would stop requiring the mask at school.
Thank you very much for that. Okay, Ms. Watkins.
Yes.
In reference to, we've talked about the kids, the students, in reference to, are they going to be required to wear masks the entire day? And we've walked through the times when they wouldn't be required to wear masks. What about teachers? Can you speak of that?
It's going to be probably very much like students. Whenever I'm around anyone, I'm wearing my mask. When students are in closer contact with me, not only will students be wearing a mask, but I would be wearing my mask and a face shield at that time. And that's, again, district provided for us. And then aside from eating lunch, teachers will be wearing a mask.
Good, good. Thank you for that. This has been a concern from several people, and it's a concern not only for the school district, but it's also a concern for private business and anywhere that people congregate, especially when it comes to touching surfaces and making sure that areas are clean. Can you, Mr. Durham, speak a little bit about how the custodial staff is going to address the sanitation of areas?
Sure, our custodians are going to be very visible throughout the day, and they'll be visible in that they're disinfected with them at all times. Especially when the kids have changed classes, that'll give them an opportunity to go through the hall and address those surfaces, door handles, restrooms, and so forth. So they'll be very visible with out and about, taking care of that throughout the day. It's not like it's going to be cleaned one time. They'll be out and about taking care of things when the kids are in class. We've also purchased these foggers where areas can be disinfected pretty quickly. That's what will be used after school in each classroom. The foggers, which have the disinfectant, will allow the custodians to go in pretty quickly and address the larger spaces all at one time. So yeah, this has been a major area. And again, making the water fountains off limits and replacing them with the water filling stations, will eliminate a lot of an area where students often have to touch. So that's been an area where we've spent a lot of time on. The custodians have gone through training from our facilities department on the proper, where we provide the proper disinfectant that is recommended to kill the virus, obviously. But so we've really stepped up in that area as far as ensuring that surfaces are going to be cleaned. The teachers will have disinfectant available to them in the classroom that they can use as often as they feel like is necessary.
Good, thank you. Ms. Rowe, I know that this has changed a little bit over the period of time from the beginning of March till now. Can you kind of speak of what the current guidance is on surfaces and how long the virus survives on surfaces?
Yes. Well, currently, what we know about COVID, the spread of COVID, is that it is a respiratory droplet, person-to-person spread. And evidence does suggest that the virus can remain viable on a surface for hours or days. So that's why it's imperative, as Mr. Durham shared, that we are providing daily and frequent cleaning of high-touch surfaces in the school setting.
Right, and we're all pushing for parents to do the same thing because
At home.
unlike when some of us were in high school, cell phones and computers, people forget that they touch those so often, and they do have to be clean, and they can be clean. I think we spoke about this a little bit earlier, but just to reiterate it, we've got a question from one of our viewers asking, why are masks not required when face shields are being worn? And I've seen this out in the community as I'm walking around. Could you please reiterate that guidance that a face shield also needs and the reason why you need to wear a mask with face shield?
Yes, face shield again is only providing eye protection. And so if this is a respiratory droplet-to-droplet transmission, we want to make sure that we are providing coverage. And so that's why the masks are imperative, that we need to be wearing a mask regardless of a face shield or goggles.
Right. Also, another question from a viewer is in reference to the N95 masks. Can you speak again in reference to the difference between a procedural medical mask and an N95 respirator?
Again, the N95 respirator, again, it filters out, it has a 95% efficacy on filtering out smaller particles. And so typically we see that those are worn in healthcare settings or where procedures would be performed, where aerosolization would be possible. And so there are some procedures in our schools that are performed for, particularly even thinking like a nebulizer treatment, where we would want our nurse or our health aide to be wearing an N95 mask.
Okay. Thank you. Another question from one of our viewers, and I would like to get the perspective of both Ms. Rowe and Mr. Durham in reference to this. The question is, are temperatures going to be taken at school, and if not, why? Many parents will not be home to take it prior to their child leaving for school. Ms. Rowe, from the public health perspective, can you speak on that?
So again, if they're not able to take a temperature, we still want them most definitely to look at the other symptoms. You know, do they have a sore throat? Do they have a new onset of a cough? A new headache with, you know, these types? There are other symptoms, and again, taking out the temperature itself. And then, and if they come to school, you know, we know that logistically, we can't check every child as they walk through the door. But if they're not feeling well at school, most definitely they will be sent up to the clinic. The teacher will call and they will come up, and we can definitely check their temperature at that time.
Okay, so you do have thermometers?
Yes,
at school
sir, we do.
You can
We
test
do.
that. Okay. Here, Mr. Durham, did you have anything to add to that?
No, we won't be able to take every child's temperature as they walk in the door. I wish we had that level of staffing, but It's just not available. But we all have numerous thermometers in the schools, in the school clinic, in the health clinics. So that won't be a problem if there's a child that we, has fever, or the parents doesn't have a thermometer and they want us to check their temperature right when they get to school. We'll be able to pull them aside and go ahead and get their temperature taken right when they get to school.
Thank you very much for that. Okay, this is a question that's been asked multiple times. In fact, today we got this question over our social media in the emergency management department. How are absences going to be handled? Can you speak, Mr. Durham, in reference to how COVID-19?
So our current attendance policy allows for, we have excused and unexcused absences. Obviously, sickness is an excused absence. Going to Disney World is not an excused absence. Well, for up to 15 days of excused absences, we simply ask for a parent note. They don't have to bring a doctor's excuse. After 15 days in our current policy, they do have to bring a doctor's note. No longer is the parent note going to be enough. Under COVID, what we're going to do is any absence that's due to a COVID-related reason, whether they got quarantined or they've been a positive themselves, those won't go against those 15 days that the parents are able to write the note. So they'll be excused, and they'll still have those 15 days where parents can write notes for other things that come about during the school year.
Okay, thank you very much. Ms. Rowe and also Ms. Watkins, this is another question that's come up quite a bit lately, is there's a lot of guidance being given to the parents on school-age children being screened before they come to school and make sure that they're not showing symptoms, they're not carrying a fever. Does that same protocol stand in effect for teachers, for other school personnel? We kind of want to get that information out there. Is it the same set of guidelines for teachers as it is for students?
Yes, that it is the same, and we ask that our teachers and our staff also screen themselves prior to school. And one of the things that we know that we see in adults is the loss of taste and smell, and so that's definitely we want them to be aware of these signs and symptoms. And I believe, Mr. Durham, they're working on a screening process for your staff.
We actually pushed out an email to all employees this afternoon that had it's very similar to the daily home screening for the student. It's the daily home screening for employees. And it just added a couple other symptoms because we know with adults that the loss of taste and smell is one that seems to be prevalent with the adults. So we added that as a symptom too that they should look out for before coming to work every day.
Okay, thank you very much for that. Got another question from the viewers. Will parents and students be trained on mask cleaning and why it's important? Can you advise if there's a place that they can go for guidance on cloth masks and how to clean those, and speak kind of the difference between the procedural masks and the cloth masks that are provided?
Right, and the cloth mask, the CDC website is always a good site. They have a multitude of resources and videos that are available on the proper use of masks, the proper wearing of masks, and the cleansing of masks. And so, of course, if it's a cloth mask, it can just be laundered with your regular laundry. If it's more of one of the surgical masks, those are disposable. They're a one-time use, and then they would dispose them at the end of the day.
Okay, thank you for that. Mr. Durham, this gives us a multi-use opportunity here. The question from one of our viewers is, will doors remain open or will they be limited access? And the reason I say that's multi-use is it's also something that prior to the pandemic we've discussed many times in reference to school safety, active shooter situations, and lockdowns. Can you kind of speak of the policy when it comes to access to the school during school hours?
So the doors, we haven't changed anything as far as our policies on the doors remaining locked due to, the possibility of intruders, active shooter situation. We've been trained on that. So we feel like we're going to have to maintain our policy that doors should remain locked whenever kids are in the classroom.
And Ms. Watkins, teachers are required to keep the doors closed?
Yes, sir, and locked.
Okay. Okay, this is another question that's come out quite often, and we just received it from another one of our viewers. Ms. Rowe, this is directed towards public health. What about people who suffer from allergies and experience symptoms that are similar to colds? And that question's come up repeatedly. If my child coughs or sneezes, should I go out and get tested for COVID-19? Can you kind of address that on when they should, if necessary, go get tested for COVID-19?
Right. And again, it's going to, what is their baseline? We want to look at what is normal for them. What is their baseline? Is this a new type of cough? Is it a different type of cough? You know, so those are things that the parents want to monitor their child for. Is this anything different from what is typical for my child, whether it is their allergy or their asthma? And if so, then they need to seek medical attention.
Thank you, ma'am. I was going to address this with you, Mr. Durham, when we were speaking about the taking of temperatures coming into school, and you kind of alluded to it about not having the staff available to be able to take all those temperatures. One of our viewers has asked, has any plan been discussed about having middle schoolers and high schoolers ride separate buses to reduce capacity in the buses? Can you kind of discuss?
So as far as our ability to distance in the bus, sort of have lower numbers in the buses, is dictated by the number of buses and bus drivers we have and the amount of time we have. And there's just not a way. We already are stretched as far as our drivers, and we have a lot of buses. We don't have enough drivers to provide that kind of service, and there's not enough time to get all the students where they need to go if we were try to limit the number of students in the buses.
Okay, thank you for that. I'm not going to ask you for particulars in reference to this because this is a kind of a tactics and it's information that we don't want to get out for a variety of reasons. But has it been addressed about fire drills and lockdown drills on how that's going to be handled? I'm not asking the particulars in reference to what's been decided, but has that been addressed?
Yes, sir.
Okay.
They'll still have the drills. They'll look a little bit different than they have in the past, but the number of drills we're required to have hasn't been lifted. Okay.
All right. And again, this is something that's come up repeatedly, and this is actually going to be the last question because we are running up on time. Can you explain how the substitute teacher program works through the schools, and do you anticipate there being enough substitute teachers if teachers start showing up with COVID?
We do have an extensive list of substitute teachers, and we don't feel like there's going to be an issue with having enough subs whenever they're needed. We've got a lot trained and some more in the pipeline. There probably will be some that decide not to work this year because a lot of our substitutes are retired people, so they may choose not to come back until things get better. But we still feel like that we'll have a bank of subs that it won't be an issue to get coverage for those classes where teachers are going to have to be out and be quarantined.
Okay. Okay. Thank you for that, Mr. Durham. Ms. Watkins, any closing statements?
I feel like we're doing everything we can to keep safety in mind for all students, and I look forward to a great year.
Thank you. Ms. Rowe?
Just like to say, we know we continue to see COVID in our community, but I want to assure that the health department is on call 24/7, working with our school district to ensure a safe return for our students this year.
Thank you. Mr. Durham?
I would just like to say that if we're going to be able to keep schools open, it's going to be truly a community effort. It's going to take everybody working together and being disciplined in what we've put in place as far as safety measures go. I mean, it's going to be the students and the parents have a huge responsibility, and we would ask of our parents. We know young people want to get together. They need to get together for social development and their emotional needs. But in having gatherings, I would just ask that they keep those numbers down and keep the types of activities that are going on at a place where it is going to be safer. So that's a huge place where parents could help us out. Students, if they want schools to be able to stay open so they can keep coming and not have to be sent home again, they're going to be a huge part of keeping us safe, by following the guidelines. And then obviously our teachers and administrators, the daily diligence in following our guidelines that we've put in place. As far as And of course, the health department and our coordination with them is going to be huge. As far as the community goes, even organizations like our churches and our youth sports associations and our Boy Scouts and Girl Scouts, all of those organizations will be huge as far as much as they can follow these guidelines, sort of like we are at the school, and that'll increase our ability to stay open.
Thank you, Mr. Durham. Ms. White.
Students are prepared and we are aware of the situation, and we're excited and ready to go back to school.
It's good to hear. That's very good to hear. In closing, I would like to say from the emergency management perspective, thank you for all the panelists. I think a lot of good information has been passed to the public. I think there have been a lot of questions that have been answered. Again, if we did not get to your question that you specifically asked through social media to emergency management or the school district, we are setting up a call line. The information on that call line will be presented to the public once we get the procedures in effect for that. And we're going to have a fact sheet where some of these questions that were not answered today are answered, and the operators who answer the line will have the answers and be able to hopefully provide that information. Again, from the emergency preparedness, emergency management side of things, I would just like to say that I am encouraged by the people of Nassau County. I am impressed by their ability to do the right thing, follow the protocols advised by CDC and the Florida Department of Health. And like Mr. Durham and everybody on the panel said, this is a combined effort. We're all in this together, and we just want to remind the people of Nassau County that we are, in fact, one Nassau. Thank you very much.